Hi, my name is Morgan, and my chapter presentation is on psychophysiological disorders and how psychological factors affect medical conditions. What are psychophysiological disorders? Psychophysiological disorders are disorders in which biological, psychological, and sociocultural factors interact to cause or worsen a physical illness, also known as psychosomatic. About 84 years ago, clinicians identified a group of physical illnesses that seem to be caused or worsened by an interaction of biological, psychological, and sociocultural factors. They are different from the factious conversion and illness anxiety disorder that are for primarily by psychological factor. Significant medical symptoms and conditions are involved in psychophysiological disorders, and that the disorders are often result in significant physical damage. Traditional psychophysiological disorders are best known as ulcers, asthma, insomnia, chronic headaches, high blood pressure, and coronary heart disease. Before 1970, clinicians believed that only a limited number of illnesses were psychophysiological. Recent research shows that other illnesses like bacterial and viral infections may also be caused by an interaction of psychosocial and physical features. Insomnia and muscle contraction headaches. Insomnia is the difficulty falling asleep. Most people it affects have temporary bouts of insomnia that last a few nights, but 10% of the population experience insomnia that lasts months or years. Insomnia may be caused by the combination of psychosocial factors, high levels of anxiety or depression, physiological problems, overactive arousal system, or certain medical alignments. Chronic insomnia feels as if they are constantly awake and sleeping heavily during the day with no function ability. Muscle contraction headaches is a headache caused by narrowing of the muscles surrounding the skull, also known as a tension headache. Chronic headaches are frequent, intense aches of the head or neck that are caused by another physical disorder. The two major types are muscle contraction or tension headaches and migraine headaches. Muscle contraction or tension headaches are marked by pain of the back or front of the head or the neck, and they occur when the muscles surrounding the skull tighten, narrowing the blood vessels. Migraine headaches is a very severe headache that occurs on one side of the head, often preceded by a warning sensation, sometimes accompanied by dizziness, nausea, and vomiting. Ulcers and asthma. Ulcers are a lesion hole that forms in the wall of the stomach or of the duodenum, experienced by over 25 million people in the US at some point in their life, and it is responsible for 6,500 deaths each year. Ulcers cause interaction of stress factors such as environmental pressure, intense feelings of anxiety, and anger. Ulcers result in a burning sensation or pain in the stomach, causing bleeding and vomiting. Asthma is a medical problem marked by narrowing of the trachea and bronchi, which results in shortness of breath, wheezing, coughing, and a choking sensation. 25 million people in the US currently suffer from asthma, mostly children and young teens at the first time of the attack. An aero chamber, also known as an inhaler, is used to treat people with asthma to help aid medicine into their breaths and live a more normal life. Hypertension and coronary heart disease. Hypertension is chronic blood pressure. The blood pumped through the blood's arteries by the heart produces too much pressure in the walls against the artery walls. Around 10% of all cases are caused by physiological abnormalities alone. The rest result from a combination of psychological and physiological factors called essential hypertension. Physiological factors of EH are obesity, smoking, and poor kidney functioning. Leading causes of EH are constant stress, environmental danger, general feelings, and anger and anxiety. Coronary heart disease is the illness of the heart caused by the blockage in the arteries. It's the leading cause of death in men over the age of 35 and women over the age of 40, accounting for 1 million deaths each year. Most are related to an interaction of psychosocial factors, job stress, and high levels of anger or depression. Physiological factors are high level of cholesterol and obesity, hypertension, and smoking. What factors contribute to psychophysiological disorders? Biological factors, the autonomic nervous system. Defects in this system contribute to the development of psychophysiological disorders. If the ANS is stimulated too easily, it might overreact and cause a psychophysiological disorder, in situations which eventually might damage certain organs. A person with a weak gastrointestinal system may be a candidate for a weak respiratory system and may develop asthma. People can show biological favored reactions that increase their chances of developing psychophysiological disorders. Stress causes stomach aches and raises blood pressure, for example. Some individuals are particularly likely to experience a temporary rise in blood pressure when stressed and may be prone to hypertension. Psychological factors. Certain needs and attitudes, emotions, coping styles may cause people to overreact repeatedly to stressors. Men with a repressive coping style tend to experience a sharp rise in blood pressure and heart rate when stressed. There are two types of personalities, type A and type B. Type A is a personality pattern characterized by hostility, cynicism, drivenness, impatient, competitiveness, and ambition. Type B is a personality pattern by which persons are more relaxed, less aggressive, and less concerned about time. In 1974, Friedman and Roseman did a study that helped prove type A and type B personalities. They investigated more than 3,000 healthy men and followed their health for 8 years. At the end of this 8 years, more than twice as many type A men developed a coronary heart disease than type B did. Socio-cultural factors in the multicultural perspective. The two major ones are poverty and race. Society's most negative social conditions. Studies have found that relatively wealthy people have fewer psychophysiological disorders and better health in general. Poor people typically experience high rates of crime, unemployment, overcrowding, and other negative stressors than wealthier people and inferior healthcare. Race. African Americans have higher rates of high blood pressure, diabetes, asthma, and are more likely to die of heart disease and strokes. African Americans also live in poverty, dealing with crime rates, unemployment, poor health conditions, and racial discrimination. Racial discrimination constitutes a special stressor that helps raise blood pressure. Hispanics also deal with the same stressors as African Americans. However, their health is at least or better than both Caucasian and African Americans. This is known as the Hispanic health paradox. New